My name is Laura, and I'm here from the West London Alliance team. The West London Alliance is a partnership between local authorities in Northwest London. And the project that I'm going to talk to you about is born out of the partnership's desire to improve the patient experience in the region. What happens often in this area of London is that patients use services across the limits and the boundaries of the boroughs. And it's really important in this context that the patients get a consistent experience of care, regardless of where they attend hospital. So the project has focused on the crucial transition of hospital discharge, the moment at which in a patient journey there is a transition between health and social care, and we all know how tricky that can be. The focus was on making the transition really smooth. And we focused on three main aspects. So the social workers have been allocated to the wards, and they work with the health teams and join the multidisciplinary team meetings that take place weekly in the hospitals. The local authority teams are co-located at key hospital sites, and this allows for a reduction of travel times and easier communications between the teams that take care of patients. And the discharge pathways have been streamlined, because as you can imagine, that number of organizations is equivalent to that number of discharge pathways, and we've worked on streamlining them down to 4. So we're going to follow the journey of Charlie, a resident in Brent. One day, he goes out for a walk and he falls and he's taken to Ealing Hospital. This is something that happens day in, day out in Northwest London. What does Charlie want? Charlie wants to go home as soon as possible. He wants to go back to his routine. He's been living alone for many years and he manages just fine. So, what is his experience of care? Well, before we did anything about hospital discharge, the care experience of Charlie wasn't that good. In hospital, nobody had real time to send the assessment notification to Brent. So his assessment of social care needs was delayed. He spent a lot more time in hospital than he needed to, because the Ealing social worker didn't really know what care was in place for Charlie in Brent. There was no communication there. There was no integrated IT access from the Ealing social care to Brent social care. This is not a positive experience of care for Charlie. So we looked at this feedback that we got from our residents in Northwest London, and we worked on what we wanted to focus on. And really, this is a little bit of jargon, but when we think about Charlie, what this means is trying to intervene early so that we can improve outcomes for patients. Personalizing the care, making sure that the clinicians, the professionals are listening to what Charlie needs early on, and that Charlie's care preferences are taken into account. It's also making sure that health and social care can rely on one another and can really trust. And we know how difficult it is to build that positive relationship between two very different professions. How did we do all this? Well, we used 2 core methodological principles, which are real values that we believe in: co-design and co-production. And what this means is that we have consulted with staff, both in health organizations and local authority, across all seniority levels, from patient-facing staff up to director of social care. We worked with everyone, including patients, and we have brought our suggestions to the patient reference groups in the area. Co-design and co-production means that we have really listened to the experts in the field, the social workers, the nurses, the physiotherapists, the occupational therapists. They told us what was needed. They told us what IT was needed, what the forms, the assessment forms needed to look like, what the pathways needed to look like. And we implemented those based on their thoughts. And the focus was always around improving the experience and the outcomes for patients. So Charlie had actually an opportunity to input into the model. Charlie had an opportunity to say what he wanted and what he needed. So what does the new model of care look like? As I've said at the beginning, we've got social workers in the hospitals working with the multidisciplinary teams. But what does that mean for Charlie? It means customer-centered care. It means that Charlie's needs are recognized, and they're recognized early. So when the Ealing social worker meets Charlie in Ealing Hospital, they are able to communicate quickly with the health staff and to relay this back to Brent to find out what care was Charlie already receiving, what extra care will Charlie need when he will get discharged. It's talking about a single discharging function. So the next time that Charlie needs to go into a hospital in Brent, in Westminster, in Kensington, he will get the same experience of discharge, consistency. And that will contribute to his experience because he will feel that he's going through the same process all the time and it's not a strange and new procedure. So let's see what happens to Charlie. The social worker attends the MDT and obtains all the relevant information. The social worker and the therapist assess Charlie's health and social care needs. The social worker quickly arranges all the care needed, and Charlie gets to go home back to his routine as quickly as possible. We've also put some measures around all this, and we have used the results of the CQC adult inpatient survey to measure the difference between what was happening before the model and what happens now. And we have seen, these are results from Chelsea and Westminster Hospital. We have seen that more patients feel involved in their discharge decisions. More patients were given enough notice of their upcoming discharge so that discharge wasn't a surprise for themselves and their families. And more patients had their home situation taken into account during discharge planning. Another important result is some key performance indicators, the more hard data that we're all used to have to look at, the DTOC, delayed transfers of care, and length of stay. At Charing Cross, which is a hospital in central London, the delayed transfers of care have been halved between June 2015 and June 2016. And this shows one of the things we're really proud of, which is how focusing on patient experience actually drives performance outcomes for organizations. Because sometimes people think it's the other way around, so that we need to focus on DTOC and then that will drive everything else. But actually, that's not the case. Quality improvement principle. We want to improve the quality for the patients, improve the working conditions for staff, so that they can work in a better way. And we have seen that this has driven an improvement in key performance outcomes. And we believe that's really central to our project. I would like to also thank Cheryl Barsdell, who's my colleague here today as well. And thank you all for listening today. Thank you.